This segment offers tips on preparing your home before you come to the hospital. We recommend that you clear the areas where you walk to make it easier to get around with the walker when you return home. Please look at the living room on the screen and identify the elements that you think could be modified to make it easier to move around with a walker. Several adjustments can be made. First, the leather footstool is in the way of getting on the couch if you are using a walker. Second, the rug could also be a problem because it creates a risk of falling. The slippers could be put away elsewhere to keep them from getting in the way. And the chair on the right of the screen could also be moved further back to leave more travel room. You can now see how the space has been cleared up by following the recommendations, making it much easier to move around the living room with the walker. This example is simply to get you thinking about what you might do in your own home to free up as much space as possible to facilitate your return home after surgery. Another helpful tip is to prepare meals ahead of time so you only have to thaw and reheat them or take them from the fridge. There are also several ways to place commonly used objects within easy reach, which can be helpful after surgery as excessive bending is to be avoided. For example, place your food and condiments on the upper shelves in the refrigerator and avoid using the bottom crisper drawer, or at least have help to reach inside. Another example is to leave toilet paper within easy reach in the bathroom. That way, you will always have some close by. You should also place pots and pans on counters or within reach ahead of your surgery to avoid having to bend down to pick them up. Similarly, you can put the clothes you wear most often in the top drawers of your dresser. In short, pay attention to the places where you have to bend down in your daily life to minimize them. What's more, you'll probably need some equipment after surgery. Since this will be temporary, several CLC partners in ST lend equipment free of charge. Usually, you'll be loaned equipment such as a walker, like the one shown on the left of the screen. Using a rollator is not recommended for the period immediately following the surgery. The walker offers greater stability and doesn't require you to use the brakes if you feel weak or lose your balance. You may also need to have a support frame installed on your toilet to provide you with stable handrails to facilitate your transfers. Lastly, you will likely need a raised toilet seat, but this depends on a number of factors, including the height of your toilet and your own size. If you need this equipment after surgery, it may be requested when you come to the pre-admission surgery clinic. Otherwise, the equipment will be requested once your surgery has been performed during your hospitalization. This concludes the video on preparing your return home. The next segment focuses on transfers.